Start. Inflammation. Very nice. What does inflammation mean? Inflammation means immune response of the body against damage. Immune response of the body against damage. Immune response of the body against damage. It means not all damage can lead to inflammation. For example, I did damage now in skin. I did damage now, but this is not inflammation. Understood? Nice. What is inflammation? Immune response of the body against damage. Or this is damage. Or this is damage plus immune response of the body. Inflammation. Inflammation has cause of inflammation we call phlogagen. Phlogagen. We have exogenous and endogenous. Exogenous and endogenous. Exogenous, biological. Exogenous, biological, mechanical, chemical, physical, social. Endogenous, any problem inside body which can lead to inflammation. But the most common is exogenous, biological. Means microbes. Microbes usually lead to inflammation. So, phlogagen is the cause of inflammation. Phlogagen. There are two types, exogenous and endogenous. Exogenous, biological, physical, chemical, mechanical. But the most common is biological microbes. Inflammation has 3 stages. Alteration, exudation, proliferation. Alteration means damage of structure, damage of cells, damage of tissue. Exudation, exit of protein containing fluid from vessel to the tissue where is inflammation. Exudation means exit of protein containing fluid from vessel to the inflammatory area. Proliferation means healing, repairing of tissue. Alteration divided into 2 types: primary, secondary. What is primary? Primary is the damage due to cause. Cause is phlogagen. So primary alteration caused by the cause of inflammation, by the phlogagen. So what is secondary alteration? It's due to primary and due to 4 changings in inflammatory area. 4 changings in inflammatory area. Which changings? Metabolic changing. The metabolism in inflammatory area will become anaerobic. Understood? Anaerobic respiration. Metabolic changing. Next, second, physical chemical changing. Chemical changing. What does it mean? In inflammatory area will be accumulated proteins. It means increasing oncotic pressure. Sodium and salts, increasing of osmotic pressure. Next, due to anaerobic respiration, the pH will be acidity. So acidosis, so accumulation of hydrogen plus. And due to cell damage, and then from inside cell will be come out potassium. So increasing of potassium in inflammatory area. So what is physical chemical changing in inflammatory area? 4. Hyperonchia, hyperosmia, hyperprotovodoroidionia, hyperpotassiumionia in inflammatory area. Understood?
Yes.
This is second changing. Third, vascular. In inflammatory area we have this is tissue. Look, any tissue consists of cells, intracellular space, vessel, nerve endings, and connective tissue. Any tissue seems like this. What is vascular changing? Vascular. In case of inflammation, first of all, what will happen? Will happen spasm of arteriole. It means ischemia. Next, changing. First, spasm. Second, dilation of arteriole. It means arterial hyperemia. Third, dilation of venous hyperemia. And last one, stasis. Stopping of blood flow in capillaries. Four vascular changing in inflammatory area. First, spasm, ischemia. Next, arterial hyperemia, venous hyperemia, stasis. It could be good visible when somebody has any damage or inflammation. First, what we can see white color, white, ischemia, pale. Then redness, when you have damage. Second color is redness due to arterial hyperemia. Next color, cyanosis, bluish, because of venous hyperemia. Understood? This is vascular changing in inflammatory area. Fourth changing in secondary alteration is mediators. What is mediators? Biological active substances. Normally they should not be in any tissue or cells or in blood, but they can be exempt in case of damage, and they can have some affecting on tissues or vessels. Now we will tell about them. Mediators are divided into two groups: cellular and humoral. Cellular, we call them in general cytokines or cytokines. We have a lot of it in the cellular mediators. For example, histamine. Histamine is cellular mediator. Heparin. Prostaglandin. Leukotrienes. Serotonin. First mediator of inflammation, interleukin 1, interleukin 6, interleukin 8, tumor necrosis factor, interferon gamma, a lot of cellular mediators. And they are coming from similar cells. For example, histamine, heparin, prostaglandin, leukotriene, they are coming from mast cell. Interleukin 1, 6, 8, 10, F, they are coming from macrophage. Serotonin, they are coming from thrombocytes. Neuropeptide, they are coming from nervous tissue, and so on. Understood? This is cellular mediators. Humoral mediators are three. Complement system. Do you remember complement system? Complement system C1, C2, C3, 4, 5 till C9, and they have several functions. C3B for phagocytosis, C3A and C5A, they playing role as chemotaxis, and we will tell about chemotaxis later. C5 by 9, they're doing osmotic lysis of microbes. Osmotic lysis, they're doing points on the membrane, and water become inside microbe, and microbe swelled and damaged. Understood? This is C5 by 9. This first humoral mediators, complement system. Second is coagulation system. And third is kallikrein-kinin system, or kallikrein-kinin system. What is the mediator of kallikrein-kinin system? Is bradykinin. And this bradykinin, pain mediator. What does it mean? It's causing pain sensation. Now you will ask me why we need these mediators, cellular mediators. In general, they're causing vasodilation and increasing of permeability of vessel, in general. But partially they could have some functions. For example, interleukin 1, he is sprayed in our body by blood. When he reaches to our brain, he increasing blood pressure, fever, decreasing appetite, increasing synthesis of acute phase response proteins from liver, increase synthesis of red blood cells and leukocytes from bone marrow, doing bone resorption. That's why we feel pain in bone when we ill due to interleukin 1, for example. Interleukin 8, he playing role chemotaxis as C3A, C5A, chemotaxis. Histamine, vasodilation, prostaglandin, vasodilation and pain sensation, and so on. Tumor necrosis factor, from the name, tumor necrosis factor which lead to necrosis of tumors. These all mediators, they can appear in case of inflammation, and where in inflammatory area, except interleukin 1, it leaves inflammatory area to blood and spread to our body. Why? To activate all our resistance system, protect system. Now look, please. We have finished with alteration, first stage of inflammation. Next stage is exudation. I said exudation, exit of fluid from blood to the tissue, inflammatory area. This tissue is damaged. We have inflammation here. For example, here we have microbe. Understood? We need fluid here. Excretion of fluid from blood to inflammatory area, we call this exudation. How the exudation happening? What is the mechanism of exudation? First of all, you already know that mediators causing vasodilation and increasing permeability, that's which help exudation. Understood? Help. So first is increasing permeability of vessel. Second, increasing hydrostatic pressure of blood. Increasing the pressure of blood in venous side, because due to venous hyperemia. And also arterial hyperemia also help. And third, which helping of exudation, that hyperosmotic and hyperoncotic in inflammatory area. It will attract fluid to itself. Three mechanisms: oncotic, osmotic. Three mechanisms which lead to exudation. Understood? The exudation, other words, means when the inflammatory area becomes swelled. Understood?
Yes, sir.
Why inflammatory area becomes swelled? Due to exudation. Now, which type of exudants inside this area? Which type? It's according to cause. According to cause. I mean, which fluid we can find inside this swelled area? According to what? To cause. For example, if the cause is streptococcus, staphylococcus, we will find pus. You know pus? Pussy fluid, pussy, yellow color. Understood? If the cause staphylococcus and streptococcus. Understood?
Yes.
If the cause viral infection, for example, we will find serious fluid. It means serious, look like watery fluid. Understood? If it allergy, so it will be watery, purely watery fluid, and so on. So the exudant fluid is according to the phlogy. Now one question developed. Why we need exudation at all in inflammatory area? Why we need fluid? For two reasons. First reason, to do border, to don't allow this inflammatory area for spraying. Understood? To do border, border of inflammatory area. Understood? Next. What is the second reason? Together with fluid, will exit from vessel to inflammatory area leukocytes. This is vessel and this is leukocyte. When leukocyte feel here is microbe here, he will first of all be adhesed to the cellular wall, to the wall of the vessel inside, due to some receptors. We call them selectin receptors, and also thanks to integrin protein for gap junction. Then it become here, then ruling, then get outside by pseudopodia, and then go directly to microbe. This we call this process immigration of leukocyte. How we call this? Immigration of leukocyte. 3 stages: adhesion, exit or getting out, and direction to the microbe. Now tell me please, how leukocyte can know where is microbe? Leukocyte has no brain, has no eyes, has no nose. How can by chemotaxis? Yes, chemotaxis means to attract leukocyte to microbe. And we said already who plays the role? Chemotaxis. CA3, 5, leukotrienes and interleukin 8 and so on. Then leukocyte coming to microbe, adheres to microbe, then engulf microbe, then capsulate, encapsule, then digestion. We call this process phagocytosis. In generally, but it's very rare diseases of phagocytosis. It could be deficit of phagocytosis in newborns, hereditary. For example, some diseases, selectin are absent or integrin absent, so defect of adhesion. Leukocyte cannot adhere to the cellular wall. This first one. Second, leukocyte cannot move cannot move due to what? Deficit of chemotaxis, no? Or leukocyte cannot have a problem in transport protein inside itself, inside leukocyte. And we call this syndrome lazy leukocyte. Lazy leukocyte. What does it mean? Lazy, yes, lazy leukocyte. And who discovered this syndrome? Chidaya Higashi scientist, Japanese scientist. Syndrome, lazy leukocyte. And last one is the deficit of digestion system of leukocyte. It's engulfed, it's capsulated, but it cannot digest due to deficit of lysosomic enzymes. By this, we finished exudation, second stage. Third stage, proliferation. Proliferation means healing. When the microbe, he destroy cells, destroy connective tissue, destroy vessel, understood, and destroy interstitial. We have to do what? To repeat again the picture of tissue. Repeat the picture of tissue again. Understood? Repeat it. How to repeat the picture? If these cells have some parts, these parts could be divided into new cells. But it depends on the cell. Can it divide or not? If cannot divide, so we need stem cells here. Immigrated of stem cells here, and then they will be divided. Also, it depends on the tissue, if the tissue can be regenerated or not. For example, skin, mucous membrane, they can. Parenchymal tissue like kidney, skeletal muscle, heart, cannot. Nervous tissue also cannot. Understood? Then, about vessel, endothelial cells, these endothelial cells, they also try to divide. They will be divided and causing vessel. Vessel, yes. We call this angiogenesis. Angiogenesis. To repeat vessel, which vessel was destroyed. About connective tissue, we need fibroblast. For fibroblast, we need macrophage synthese factor, growth factor of fibroblast. Growth factor of fibroblast. For proliferation, we need growth factor and inhibitor factor. Growth factor and inhibitor factor. Why we need inhibitor factor? Because if growth factor will continuously acting, these cells will continuously dividing, and it will lead to what? Tumor. I know you, but now we will finish. Yes, now we will finish. Last thing, what I wanted to say: inflammation, two types: acute, chronic. Acute, the cause is hard and short. Chronic is not long. What also the difference between acute and chronic? Acute, it could be maximum alteration, exudation, and finish. Chronic to proliferation, and proliferation will be prolonged stage in chronic inflammation. Understood? The main cells which play a role in acute inflammation is lymphocyte. In chronic is macrophage. Last thing what I wanted to say, not last thing, but last thing anyway. 5 symptoms, local symptoms of inflammation. 5 local symptoms of inflammation. Rubor, tumor, calor, dolor, functionalism. Rubor, redness. Calor, temperature. Tumor, swelling. Dolor, pain, and loss of function. This is 5 symptoms of any inflammation. And inflammation we call it by suffix itis. gastritis, hepatitis, encephalitis.
Arthritis.
Except some organs, for example, lung, pneumonia, we call it, not itis, understood? How to treat inflammation? We have 3 therapy, you know already, 3 therapy. First therapy, atheotropic therapy to remove the cause. If the inflammation due to microbe, for example, bacteria, we give antibiotic, yes, to remove microbe. This is atheotropic therapy. Next therapy is pathogenic therapy.
Yes, sir.
To remove mediators, for example, to inhibit mediators. And the most common is diclofenac. You know diclofenac? Diclofenac of sodium or diclofenac of potassium or diclofenac, other names, some names. Last therapy is symptomatic therapy, to remove symptoms. For example, if he has fever, we give something for antibiotic to remove fever. That's what I wanted to say for you about inflammation. Thank you very much for your attention.
Thank you.